Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
To the Beauty Sciences. I am Dr. Kristy Hamilton here with my amazing colleague, Dr. Roy Kim. We are both board certified plastic surgeons, and we are today talking about pediatric plastic surgery and specifically laceration, cuts to the face. This is something that all plastic surgeons are very well versed in, and I think it's a very common experience for parents because little kids fall and cut themselves. So right. What happens when you get your opposite fall of your patient's child has like fallen on the playground and has a cut on their face? What does that process look like?
We talked a little bit about this before we started recording. I think today, if you go to an emergency room or urgent care center, the the main doctor there will want to probably sedate your child. And this is something that I think parents aren't getting full informed consent on, or they're not understanding the full ramifications. I'm a plastic surgeon. I'm also a father, and you're a mother and you're a plastic surgeon. And I feel very differently. So there are basically two ways to go: sedate the patient, wait a little while, and then fix the laceration. The other option is to just use local anesthesia. So the problem is that assuming you have a young child, they may not fully get it. I always have to explain to the parents and to the child, hey, you're going to get one painful shot. Not that bad, but it will hurt where you have the little cut. Once it's numbed up, you're going to be good for a couple hours. So while I'm fixing it, you're fine. But also when you leave the hospital or emergency room, you'll be fine. But it is discomfort with that one shot. I also tell them that they're going to get an IV with sedation. That's not fun, but it's shorter. There are some other things. So that's San Francisco. I don't know what it's like in Houston. Is it similar?
Very similar, though. I will say from when we were in residency, when we were, my gosh, I can't tell you how pediatric laceration repair we did in the emergency room. We only took really, really serious things to be operated through without anesthesia. So if it was something like a horrible accident and we knew it was going to take a long time, well, then we would just take those straight to the operating room. But most of these cuts are like, they're very organized, like a chin, a cut on the cheek, a bite, something like that. And so those patients would typically be given ketamine. They had to be at meaning like they couldn't have eaten or drank anything for a period of time before. So these kids and parents were really miserable by the time we finally got to them because, to your point, they had to get BIV. That can be really hard to get on a 5-year-old that's thrashing around. And so everyone's pretty tired, hungry, and we were usually doing these things at like 2 or 3 a.m., even if they had happened during the day. So it's interesting the two options that you have. Most patients don't even know that you can probably call your local plastic surgeon, and likely some offices will help you. My patients know if it's like if they're our patient and it's their child and they call, like we will do everything that we can, short of being in the operating room all day to get to that child and help. And I think to your point, it's like, do you want one lidocaine shot in the cut, or do you want to get like a much larger needle with the actual IV placement? Like I would argue that probably hurt just as much or maybe even more than that one lidocaine shot. So it's really more about managing like the patient's anxiety if you're going to do it awake, and lean into having the parent helping us calm the child while we repair everything, and maybe watch a little like K-pop demon hunters on the side. Sounds a little like we were saying.
Yeah. To make it really detailed and really clear, what Dr. Hamilton's describing is, number one, if you have a child and you want to give them sedation, that's nice. They can't have just eaten. They need to have an empty stomach. They need you to pop an IV somewhere in the blood vessel, wait until X amount of hours after their last meal, then give them some sleepy medicine. Then plastic surgeons like her and me, we walk in, we still have to give you a shot of numbing medicine, and then the patient's drowsy, and then we close it up. Then you get to wait a little longer because the patient, your child, has to wake up from the sedation medicine. So I think if you deliver it factually, not in a negative way, and you're telling patients, you may be here for 4 hours, 6 hours, 8 hours for a tiny laceration, versus not much fun, but in young children, it's not much fun at all. But you unfortunately have to hold them down and give them a shot of numbing medicine where they have the cut. Then you wait, typically 10, 15 minutes. turn down the lights, mom and dad are there, they're still scared, or sometimes they just tire themselves out. And then when you fix the laceration, they're feeling no pain. The numbing medicine lasts for a couple hours. They're literally feeling no pain. And once you're done, you're out of there as soon as they can sign you out, like 1 minute, 10 minutes, whatever, but you're done.
Yeah, and that's how we can do it at our office. So when patients call, I just say, hey, like we can't go the sedation route, but if you're comfortable with it, then that's how we can take care of the child. And I said, like the whole family gets involved sometimes. I was joking that the last one I did, the 5-year-old, like slightly older sister was there, like holding up the iPad, like playing a cartoon. And, after we gave him that initial iPad shot, he just was watching his TV and even like singing a little bit along with his older sister, while we were doing it. So I think one of the most challenging things is when we pull plastic surgeons and ask them what they would choose for their own kid, if their parent. When I would think before we filmed this, like both of us would choose that route. It involves not giving your child mind altering drugs, and it's just a little bit cleaner of a way to do it. I think if you have enough, yeah, to make sure that everyone still procedure.
Yeah, I have repaired some minor cuts on my children that were fairly deep under local anesthesia in my office, and they were not that, unhappy. Granted, maybe they're trusting dad, but in general, I'd recommend just local anesthesia. So this is where we differ, I think, from our esteemed pediatric emergency room colleagues.
Yeah, yeah. And I'm the same when we talk about, oh, is this going to be traumatizing to the kids? When they come back and they see me and they remember vividly who was that, did this to them. I find they're not scared of me. They'll give me a high five. We give them a lollipop on the way out or a sticker, and they're just back to having fun. So I think another difference between like adult and pediatric, and I don't know about you, but we use absorbable sutures for all of that. Child doesn't have to go through like an working experience of having sharp close to their removal. So it truly can be like a one and done. And then we move on to managing the scar, which how do you manage pediatric patients after the repair?
It's just like adults. The problem is that typically you have to tackle your children to make sure that they have sunscreen on. Sometimes it's better to just let them wear a Band-Aid, like with little cute cartoon characters, because they'll actually wear it or like it. But essentially, adults or children, you want to protect it from the sun. The nice thing is that in children, it typically heals better.
Love the Band-Aid route because you don't have to worry about it. Like if it's on their forehead, you can put a hat on them and hat really good to stay on when they're at school. So yeah, little cute Band-Aid just I think takes that away, and then that sunscreen for after they're out of the acute phase. I'll add some of the older children to do the like silicone gel massage. I tell the parents just do the best you can with that, and we can always laser it down the road if we really want to work on the scar later. But I think to your point, like kids heal amazingly well as they grow and their tissues are remodeling. I think those scars fade really, really nicely. Because like almost everybody's got a childhood fade scar. I know. I got one right here.
Yeah, I have one over here. So, everybody has one. Yeah.
Yeah. And we don't
And
see that.
yeah. And I think the other thing for parents, and this may be hard because parents don't have like clinical judgment. If it's sort of like shallow, not that deep, I don't know if you need to see a plastic surgeon. So specifically, a lot of ERs are already proactively using glue or using special strips to hold it really together well. That definitely helps if the problem is not deep. Now, the thing is, if it's relatively deep, you probably want stitches. And at that point, you may want to see a plastic surgeon or somebody to put stitches in. But obviously, I think for the average person, civilian consumer out there, that's sort of hard to judge.
Yeah. Because I think I'm you have a very similar experience, but I get texted photos all the time, and it could be people that are local or like friends from different regions of life that are living in Houston, and it's like, do I need to go? If you are doing to go to plastic surgeons, and the answer in general is like, I go, is it gaping? Like do you just see like a line, or is it like split apart? If something's split apart, you almost certainly need suture. Sometimes even if it's like together, if it can be easily like pulled apart and just be amicable, to your point, that's also going to benefit from sutures. And then it depends, gender of the child, where it is, all the things. If they're small, they're going to heal. But if they're not, if the edges of the skin are not together, then that is something that can form a wider scar or obvious scar, and it matters whether it's like under the chin versus like right in the middle of the cheek. So those are all kind of distinguishing factors. And I think anything that works out bleeding, that's another reason I go
Yeah,
get
yeah.
sutures.
Bleeding or it's hard to control, that's definitely a sign that it's a little deeper.
Mhm.
But,
Yeah.
well, hopefully for all the parents out there, now you know about pediatric lacerations, and now you know maybe sedation may not be for you or for your child, but maybe you strongly prefer that route. At least I think you have, like, how do you say it? Like more information before this ever happens.
And then maybe you can avoid the ER and the wait and all the illness that's in there and contagion entirely, and maybe just go to your local plastic surgeon's office. That can be
Yeah.
nice too.
And get it done in an efficient manner where, who wants to have a shot that hurts, but you either have the IV and you get to wait, or you get one shot in the area and then you're out of there very quickly.
Quickly. So that's the 411 on pediatric laceration repairs and how you can pursue those. Always ask for a plastic surgeon, I would say, whether you're in an emergency room or in the clinic, because that's to me why you've been waiting for so long to have an expert do it. And we look forward to welcoming you to our next episode. Stay beautiful.
As always, stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.